area, order food, and practice taking the food back to them, back with them to a table. In between, we would do parking. So as we were rolling and navigating back in the wheelchairs, we would stop and our wheelchair user facilitators would show their different vehicles, their adaptive vehicles, their cars, talk about difficulty with parking and sometimes why they might be late to different events and things like that. So that event lasts typically about 1.5 to 2 hours. And we really switched to this model from our students being the participants to more the facilitators with the wheelchair users. So in our DPT curriculum, we have a lot of ADA components. We obviously learn wheelchair parts, how to order wheelchairs, how to facilitate somebody using a wheelchair. So we thought it was a good teaching and learning opportunity for our students to actually be with the wheelchair user facilitators and help run this program over time. So it's evolved to where our students will do this typically about once a month, and we'll use different societies, different organizations on campus. So we've done this with sororities, fraternities, different sports teams on our campus, the School of Public Health, pre-PT, pre-OT, pre-PA Society, our Health Service Administration program, just a wide variety of different student groups to partner with this. And it's been great because a lot of these students actually go on to healthcare fields. So what about the medical school? So Will teaches anatomy in our program, and he actually came to me and said, hey, who teaches about different like wheelchair parts and things like that in your curriculum? And I said, it's actually me. So we came up with an idea to start Come Roll With Me in the medical school, and will touch base on that in a minute. But we dug into the evidence and we were like, would this be beneficial for the medical trainees to go through? And overall, yes. So about 1 in 4 American adults are affected by disability. So this is the largest minority group in the United States. Mobility is the most common disability, so about 13.7% of Americans having an impairment that affects their ability to perform functional mobility exists. So that's really significant, especially for healthcare workers. And you think about the setup of clinics, the setup of hospitals, and things like that. We know that many of these individuals have unmet healthcare needs, and individuals that have disabilities oftentimes report less satisfaction with their healthcare. A structured and consistent training for the care of these individuals is lacking in medical schools and residencies. And then half of US medical schools actually lack a disability awareness program, and 58% of medical school deans report that curriculum for persons with disabilities is not a high priority. So we definitely thought this is a great area for us to expand in and help train some of the medical trainees on mobility deficits. So I'll let Will take it away with how we came up with Come Roll With Me, You and Me.
All right, thanks, Ashley. So I really want to give props to Ashley and all of her colleagues in PT because they've been really, really super partners for us in the School of Medicine to really get this up and running and to really make this a really effective learning experience for our trainees, both our undergraduate trainees, and we'll talk later as well about our graduate trainees on the GME side as well. So taking what all the folks in PT and Kathy Carver had done in the PT program, we developed a iteration of this for our medical students that, of course, we call Come Roll With Me. And this is the undergraduate med ed version of it. And we'll also speak a little bit later on about the residency version as well. So what does this look like for our medical students? So we program this as a 2-hour interprofessional learning experience for our medical students and also for the physical therapy students. And these are for the courses that we embed this activity in. These are second-year physical therapy students who are taking the Management of Neuromuscular Dysfunction 2 course. And typically there's around 60 students in each cohort of the PT program. And these are also second-year medical students. We have around 200, a little under 200 usually, medical students in the second-year class. And we embed this activity in their musculoskeletal and skin module. And so for 2 hours on 2 afternoons during each of these courses, these two student populations kind of collaborate together along with other individuals for our Come Roll With Me event. And so it's a lot of students, right? So we have, 250 plus students plus our facilitators. So to make this like doable, we actually break them up into lots of different individual groups. And so each group will function as one cohort, if you will, that will move through the Come Roll With Me activity. And so each group will basically be comprised of 10 to 12 medical students, 3 to 4 physical therapy students, one licensed physical therapist, usually a faculty member in the PT department, and sometimes a clinician from our local hospital, as well as 1 or 2 wheelchair users from the community. Now, these wheelchair users are largely recruited by Kathy Carver, and many of them are her former patients. So, as Ashley, alluded to, Kathy was the brain for this entire activity, really. And many of the individuals who come and take part in the activity that we do, and also that's done, all around town, are her former patients who she has helped through their sort of their process. And so she recruits a large variety of individuals to engage in these activities. And every year we do this, there are different combinations of individuals from the community that help us out with these activities. There's a large variety of sex and race. We have some that use manual wheelchairs, some that use power wheelchairs. And also the etiology is quite varied. Some may have something like spina bifida or CP and more of a congenital etiology, whereas others may be more a traumatic reason why they use a wheelchair. Anything from a motor vehicle accident to even one individual who had a crush injury after a tornado struck his home. So a very large variety in the backgrounds and experiences of these individuals. And I think that really adds to the richness of the activity to have such a large variety of individuals with very different lived experiences that really help teach our students in this activity. And you can see here from the picture, this is a picture of 4 of our wheelchair users in one of the years that we did this activity. All right, so what does this look like in the actual practice? So each of these groups that I just described are going to rotate through 4 different stations over the course of that 2-hour time period. So roughly 25 minutes for each of these 4 stations. And so the first station is what we call the self-propulsion station. So for this activity, the medical students are given a manual wheelchair and they will basically propel themselves through the inside and outside of one of our academic buildings. And we kind of set up roughly a path or a course for them to go through, which will include academic room, like a classroom, for example. Typically, they go into the bathroom down the hallways and also going in and outside to experience some doorways and just general like movement on a sidewalk as well. And to help them out along the way, we have our physical therapy students acting as teachers. So they actually provide some basic instruction to our medical students on, the basic parts of a wheelchair, how to use it appropriately, how to not tip over and bump their heads on the floor, although it does happen on occasion. And then we also have our wheelchair users as well, who are going to be instructors, giving tips and so forth about their experiences utilizing a wheelchair. And then the second of our rotations is going to be basically around transportation and parking. And so for this, we take all of our students and our community participants out to one of our nearby parking lots. We work with our UAB parking department to reserve parking spots for our users. Which is always fun when you deal with big UAB parking to make sure we can get spots reserved and they don't get taken up by other individuals. But the goal is to reserve parking spots for our community partners to come in with their vehicles. And so then we'll bring our students out to the parking lot, which is usually pretty close to the building where we run this activity. And they will then just talk about their vehicles, the accommodations their vehicle contains, typically demonstrating, if it's a ramp like a van, or if they just self-transfer and take their wheelchair apart. They typically demonstrate this whole process to our students. And then we get into the discussion of cost. And what are the costs of purchasing a vehicle and then making the necessary modifications to the vehicle so that it can be used by these individuals, both getting in and out and also just driving the vehicles themselves. And then we typically also move the conversation at that point over into what are some barriers they face just getting to the hospital, finding parking. How do they find the accessibility of healthcare in general from a very logistical standpoint? Whether they use public transportation, which in some cases our participants do, or if they drive themselves, just all the different aspects of accessibility of healthcare from a very practical standpoint. And then our third rotation is all about transfers. And in this rotation, our PT students again really rise to the top as one of our main educators. And so, as physical therapists, they will be doing lots of patient education, teaching their future patients how to transfer safely and effectively if they have a new injury or something of that nature. And so, we actually use our PT students as educators, and within little small groups of 3, 4, 5, each PT student will basically teach a small group of medical students how to perform a few basic transfer techniques, a pivot transfer, a stand transfer, how to use a sliding board effectively. And the goal here is to give our medical students some very basic skills. So if they have a patient that comes into their clinic that needs to transfer from a wheelchair to an exam table or to the MRI machine or something of that nature, like what are some basic skills they can use to facilitate that? But also, how do you approach that in terms of conversation? So again, we have our wheelchair users right there on site. And we talk about, how do you ask someone if they need help? Do you just do it? Do you ask them first? How do you actually engage with these individuals if they were to be your future patient to see if they do need assistance? And if so, what does that look like? And then how can they actually assist if that's necessary? And so this is a skill our med students will hopefully take away from the activity, and also gives our PT students a great way of practicing that patient education aspect of their future career. And then finally, we have just an open dialogue. So we spend about 25 minutes just open conversation with our community partners. They typically speak about their history, what their pathology might be, what are their experiences like accessing healthcare. And they have a very open conversation, allowing students to ask all kinds of questions about life with a disability, about the cost of healthcare if you have a disability, about accessibility, both the good and the bad of accessibility, and just having a very frank conversation with our students, which is a very rich experience. And so over 2 hours, we go through each of these 4 activities during our Come Roll With Me activity. And so we've collected some data on this over the past few years, and I'm going to share some of that data with you next up. So I think this was the second iteration of this with our medical students. We had our students complete a couple of surveys to really dive into do they see or do we see some changes in how they perceive disability in general, and what are their perceptions about disability in patients or people from the community who might actually have disabilities. All right, and so one of the surveys that we administered was the APPD, which is the Attitudes and Perspectives Towards Persons with Disabilities scale. And so this is a scale that's been used in the literature and validated to really look at social attitudes towards individuals who have a disability. And disability is defined very broadly for the purposes of this scale specifically. And what I want to call your attention to is that the scale is broken up into a few different subscales. There's the community integration subscale, discomfort, charitability, and the sense of burdening. And if you look at our physical therapy students who completed the survey, you'll see there's really no difference either before or after they engage in Come Roll With Me and other types of disability type settings. And that's really not unexpected because the curricula of a PT program is rich with these kinds of activities because it's a core part of the physical therapy profession. So we really weren't surprised to see that Come Roll With Me had no effect on PT students' perceptions about disability. But when you look at our medical students, what you'll notice is that there was a statistically significant increase or improvement in their perceptions about disability in each of these subscales after engagement with Come Roll With Me. Now, if you look at the actual numbers right here, you'll see that lower numbers in this case are more positive attitudes toward disability. So the lower numbers are good, the way this scale is set up here. What was also interesting for me, especially, was, I want to get my medical students to have very positive attitudes that are on par with their physical therapy student colleagues. And so we compared our medical student perceptions with those of the physical therapy student perceptions following Come Roll With Me. And as you can see then here, whereas before Come Roll With Me, so if you look at the pre-data right here, PT students largely had much more favorable perceptions. But following Come Roll With Me, that difference was really neutralized. And so following Come Roll With Me, and again, this is a very short-term look at perceptions. We have to look at long-term outcomes of this, but at least for the short term, the perceptions of our medical students were on par with those of the physical therapy students, which for us, I thought was a very positive outcome of this even single one afternoon activity. So we went on and looked at this as well through a separate scale, but looks at similar outcomes. So this is the multidimensional attitudes scale towards persons with disability. And this one looks more specifically at individuals with physical disabilities. And so the way this survey or this scale is set up is that if you take the survey, you're given like a vignette, like a narrative of a situation, and you're placed in that situation and asked about your perceptions of interacting with someone with a physical disability for the first time. So it's very situational in the way it's set up. It's broken up into three subdomains, affect, cognition, as well as behaviors, and then you have the overall. And we saw very similar outcomes for this data as we saw in the previous scale. So again, our physical therapy students, no big difference in their perceptions either before or after participating in Come Roll With Me. And then for our medical students, we did see some improvement as well. And then looking again at the physician student versus PT student comparisons, whoops, again, we see that post-survey right here, no significant difference. More or less, our PT med students had very similar perceptions following the Come Roll With Me activity. So in addition to looking at some of this more quantitative data, we also did what we call a qualitative analysis as well of these activities. And so we've done this a couple of different ways. We've done focus groups. We've also done reflection essays by our students. And so this data I'm showing right now is from reflection activities. So one of the years that we did this activity, we had all of our students, so medical and PT students, write a reflection essay after the experience. And then we coded and did a thematic analysis of the reflections to see what were the major factors that came out. And this was a response to two prompting questions. So the first question prompt was, describe the barriers to wheelchair users and other individuals with disabilities of which you were unaware prior to the IPE event. And when describing the barriers that they learned about or were previously not familiar with, they kind of fell into four major domains: financial barriers, social barriers, accessibility, and barriers that were pretty specific to the wheelchair itself. And we break these down then into kind of the major sub-themes that resulted from this. Financial barriers that were noteworthy were just the cost of healthcare for people who have disabilities, and also the cost of insurance and just the barriers to dealing with insurance if you have a disability. Also, just the sheer cost of accommodations, whether that's purchasing a wheelchair, whether that's paying for modifications to your vehicle or other just cost in general. There's a huge financial burden placed upon people just by having a disability. And students really wrote a lot about that not being a realization until they engaged in this activity. And then this one was more unique to our PT students, but they also spoke a lot about some of our community partners in, talking about just the difficulty with obtaining and keeping a job, just being employed while having a disability. And we kind of saw in general that PT students had a deeper level of thinking in their reflections, which may be indicative of just they've had more time to think about all this, whereas more of a superficial early exposure for medical students. In terms of the social barriers, a lot of things around communication, difficulty communicating, as well as just the social stigma that may come with having a disability. Accessibility, they wrote a lot about parking and vehicles, as well as public accessibility. And then also they spoke a lot about their academic building, which was Volker Hall, being very, very inaccessible. So they were very surprised by a building for medical education lacking a lot of features really necessary to really be accessible. And they wrote about that a lot in their reflections. And then finally, around the wheelchair itself, they're in a musculoskeletal course. They're learning about, muscle injuries, rotator cuff tears, bicipital tendonitis, all these shoulder pathologies. And they learned that these shoulder pathologies are more common in those who use a wheelchair due to just the wear and tear that comes with self-propelling a wheelchair. And so just the strength needed to physically propel a wheelchair and also some of the healthcare outcomes that may come from using a wheelchair sort of rose to the surface. And then our PT students, again, a little bit more deep in their thoughts here around maintenance of wheelchairs, as well as the importance of properly transferring individuals for their own physical safety and also the safety of their future patients. So really the importance of good education so that they transfer appropriately for their own and for the patient's well-being. So then the second prompt for our qualitative analysis was how will you as a physician or physical therapist and citizen work to remove these barriers in healthcare? And so these kind of fell into three buckets: self-education, improving the healthcare experience, as well as improving accessibility. And our students spoke a lot about the desire to further educate themselves on things like communication and proper etiquette with individuals who have disabilities, around understanding insurance and medical care, maybe nuances for disabled individuals, as well as the need to better educate themselves on what are all the community resources available that they may be able to refer patients to help them out. Improving the healthcare experience, they spoke a lot about their future clinics. If they go into private practice, for example, and they're designing their own clinic, thinking about the needs for both inside and outside accessibility features. So their future patients will have easy access around communication, as well as around just breaking down those social stigmas. And then finally, improving accessibility. There was a lot of talk by our PT students around advocacy and being strong advocates for their patients and this community, as well as the need to really deal with issues as they arise and not kick the can down the road, so to speak. So then finally, as we kind of wrap up the data section of this, we also did focus groups with our guests. So we did a focus group session with our community participants to kind of see, okay, what are your thoughts about this activity? What did you find to be good, bad, ugly, etc.? And their thoughts fell into three categories here: education, impact on students, as well as teaming. In the education domain, they were really, really verbal about the importance of individuals, healthcare providers, seeing them as people and not disabled people. And they felt that they made progress on that with this activity, and also just the need to break down barriers for medical care. They were very positive in their discussions around students and the students' level of engagement, asking questions, seeing the surprise on their faces when they saw the price tag on a wheelchair, for example, and also around importance of teaming in both the physician, physical therapist team, and also the importance of the PT and patient and provider teams as well. So through that, we kind of built out we call our educational schema. And so this is how we envision Come Roll With Me as an educational tool. And so if we think about our medical students as the primary, learner in the setting, they're learning from our faculty, they're learning from our PT students, and they're also learning from our community participants. But in doing so, then they, as well as the PT students, are going to be teaching other healthcare providers and other future colleagues in their future. And then through that self-reflection, there's also a strong desire that we saw for both medical students and PT students to self-educate themselves to further fill out their understanding of these domains and areas. And so with that, I will turn it back over to Ashley to talk about how we've expanded this now to the GME world.
Okay, I will pre-warn you, we haven't done as much research with the GME aspect of it, but let's talk GME now. So, how the GME version of this began. So, I serve as a physical therapist for our transitional clinic. So, this is a clinic that helps individuals with complex medical needs transition from Children's of Alabama into the UAB system. So, our MedPeds resident director founded the clinic. She runs the clinic, and she started having some conversations with me about come roll with me because she saw some of the publications and some of the social media promotions about it and was very curious. So we started having conversations with other residency directors, and overall, there was a general sense that many residents didn't feel comfortable interacting with individuals with disabilities. And this is kind of from all angles, not only mobility, but those who have sensory deficits. We saw a huge need for autism population, which is something we hope to kind of build in the future. So we formed a research group. So we have our UME research group that came together, but we added in our MedPeds residency director and then our PM&R residency director to kind of be leads on this because they know the objectives for GME really well. They knew exactly how we needed to tailor it to kind of hit some of those things that are required in residency education. So we really did this from an all angle approach, not only the Department of PT and Heersink School of Medicine, but really getting the residency aspect involved. So you can go to the next slide. All right, so here are the aims we wrote for our grant. So we were awarded a $65,000 grant through UAB to kind of get this program up and going, and we're currently in our no-cost extension year for that grant. So the overall aims we wrote were that we were going to adapt Come Roll With Me from UME to GME to promote disability awareness and enhance effective skills to improve patient care. And the effective skills was really big for our residency directors, and they felt like we needed to really hit on that point. One thing that is difficult with GME, as you all know, is the timing aspect. And we were like, can we get away with a 2-hour event? Yes or no? And what we've really found is that we carve out 2 hours for this event. A lot of times people need to leave early, they need to come a little bit late. So we use part of our budget to film videos of the station. That and things like going down to a parking spot outside of UAB Hospital is nearly impossible. So our parking deck is way far away from where we end up doing this event. So we recorded videos like how to do transfers, the transportation video. So we can kind of substitute those in. So if we need to do a shorter event, we can give the residents links to these videos that they can watch to see if they can supplement the real deal. So we use this interdisciplinary approach, and we originally wanted residents from different programs. So we wanted internal med, peds, emergency med, surgery, PM&R, family med, for instance, to all come together. So we could do cases and examples of, I have this patient who is a wheelchair user. They are now going to the emergency room. They need an MRI. What do we need to think about in that instance when they're being sent there? How do they transfer on and off of the MRI machine and things like that? So we sat down with our residency directors and made these scenarios that we could discuss during our panel discussion, and we can include our wheelchair user facilitators and their experiences. And then we wanted to evaluate the GME version of Come Roll With Me through a sequential explanatory mixed methods approach. And this is where we're kind of lacking in terms of meeting our aims. But we, again, use the APPD scale, which Will already discussed. And then we use the Disability Attitudes and Healthcare scale. We also are about to start doing focus group interviews because we found timing wise, nobody has time to fill out these surveys. And you'll see with our results here in a second, we do not have a great amount of data because of the timing aspect of filling out surveys during your already busy day. So here is our budget and what we kind of spent our money on. So the main thing were wheelchairs. So Kathy Carver got us great discounts for wheelchairs from different vendors around the city because they're a huge proponent. They really are great supporters of this event. So we not only got manual kind of off the shelf type wheelchairs, but we got custom chairs. So we have custom backs, custom wheels. We have all the bells and whistles on these different chairs so we can explain the different parts and talk about when somebody is getting fitted for a wheelchair, they're doing a seating about why they might need these different parts and how a wheelchair might vary if you're using it short term versus long term. So that's why I have wheelchairs in my office with me. I have the very expensive custom ones. They just live in my office with me at this time, and our others are down in a closet. We bought cushions and different types of cushions for our wheelchair so we could show our learners what cushions look like and different cushions that somebody can get, what a cushion might look like in terms of somebody who has different diagnoses. We bought sliding boards for transfers, gait belts for transfers for safety. Again, we spent money on the videographer who did probably about 7 or 8 videos for us that we're working on getting up on the website. We paid our wheelchair user facilitators, so we have a pretty big stipend that we will pay them to come and help with these events. We buy lunch for all the residents because that is something that is just absolutely necessary. If you're going to come to this event from 12 to 2, you have to be able to eat lunch. And then we have various supplies like a labeling system for our wheelchairs. So this is what GME looks like. Again, we block off 2-hour sessions on Thursday afternoons from 12 to 2 in our big conference room. Typically, we have about 20 to 45 residents per session. We actually did one that was pure pediatrics the other day that was a little bit larger than that. They had about 50. We do an overview of Come Roll With Me while the residents eat lunch. And this is when we show things like our transportation video, since we don't have access to a transportation spot that's close by. Then we split them up and we have one group do the navigation and the wheelchair propulsion section while the other group learns transfers. We spend about 20-ish minutes with those and then we switch and do the other half. And then we come back together for that panel discussion and the pointed questions to target specific objectives for our residency programs. So you can see in the table here, we kind of originally estimated doing about 334 residents through this program every year. Here are our results again. We don't have great results. Only 22 people have filled this out in the 2 years that we've been running this program, the pre-survey, and then the post-survey, we only have 4. So we definitely need to think about different ways to kind of get these surveys filled out or just go more of a qualitative route. And we've gotten a lot of word of mouth feedback about how helpful this program is. But again, you can see that it's difficult to fill out these long surveys, especially when you have a really busy day. But you can see there's things like mixed comfort levels with performing transfers off the bat. But then our post-survey responses show improved attitudes across most of the domains, specifically reduced discomfort and greater awareness for individuals with disabilities. So we wrote a paper that was called 12 Tips for Including Disability Awareness in UME, but this also applies to GME. So we'll read through these kind of fast and then we'll answer questions. So number 1, to embed persons with disabilities into all phases of the curriculum. And we can't overemphasize this. They are the complete backbone of this whole Come Roll With Me endeavor. They help us with the curriculum. They help us with our research. They're the ones who run the show, and we couldn't do it without them. We follow Kern's 6-step method for curricular development. Utilize diverse clinicians with experiences working with persons with disabilities. So again, we have Kathy Carver. We also bring in neuro-certified PT specialists that help with the events. Include IPE elements, which is critical. And I think we've done a really good job of combining PT and MD and getting a nice relationship between our students. Include a broad spectrum of disability types, which we hope to expand this to low vision next and then go into sensory and things like that. Include a variety of pedagogies, so emphasizing experiential learning, which is key here. Nobody wants to just sit through a lecture for 2 hours a day. It's really actually getting into action. So I'll let Will finish our tips.
All right, so number 7 here, ensure access to appropriate equipment and facilities. So importantly, oftentimes physicians are the ones that are going to be prescribing things like a wheelchair, but they need the PT expertise to know what to prescribe. And so helping them kind of learn that and see some of this in real life and why the diversity of resources and equipment is important. Introduce students to the ADA, simulate firsthand experiences. As you all like to know, there's a lot of literature around simulation with disability and maybe the pros and the cons. And we do feel from our experiences that there's benefit to this if it is couched the right way. And that's why it's so important that we include, and I encourage all of you as well to include individuals with disabilities and lived experiences into your simulations, really to mitigate the risk of problematic experiences if you go the simulation route. Open dialogue is also hugely important. Have open conversations, and we've been very fortunate that our community partners are willing to come in and really speak openly about their experiences. If reflective elements are also really key to give students a chance to pause and think about their experience, what they've learned. And then finally, really what we're working towards now is moving that single day experience into the longitudinal experience. So, having activities on the preclinical side and during the clinical years, and as well now is in the residency training time period as well. So that it's not a one and done, but more of a continuous training that begins in med ed and hopefully will continue on into CME as well. All right, and so just quickly to summarize, and then we'll take any questions that you have. Um, we feel very strongly that IPE and social medicine, health equity can and should be included in both undergraduate and graduate medical education. And Come Roll With Me is one of several ways that you could do this. It's a great way for us to really mix our physical therapy students and our medical students together to get that really effective IPE collaboration and use that as a springboard for disability education. And then from our experiences and speaking as a medical educator, I can say that I think physical therapy students and physical therapists who are clinicians are a really untapped resource in medical education. And we've found a lot of success in this great collaboration we've established with our PT partners in doing this. And then lastly here, another underutilized resource, I think, are those individuals from the community who have lived experiences. I think we need to tap as a med ed big picture, tap more into our community partners and leverage their experiences and their expertise as part of our training for future physicians. So I'll end here with a quick quote. People with disabilities have great insight into their own condition, and this can ideally make their relationships with health professionals more of a partnership where each can learn from the other and where disabled people and their healthcare choices are respected. And then I'll also want to acknowledge all those who are part of the team. So Ashley and I get to talk to you about this today, but there are tons of people who have been working on this as well. Kathy Carver was really the one who got all this started. That we have lots of people in medicine and PT who've helped us with this. And then I definitely want to acknowledge all of our community participants. I think there's 5 of them shown right here, but the list is extensive of all those who've come and engaged in one or more of these activities to share their experiences and be teachers for our students. And with that, I will acknowledge our publications. We'd love for you to look up any of these if you want to read and learn more about the things that we've done. And thank you for your time and the invitation to speak and answer any questions that you may have.
All right, thank you both so much. It's really interesting. And let me open it up for any questions online first. Anyone have any?
No.
You're good?
Keep the applicant to go back to 12 part, the first line.
Mm-hmm. Okay, real quickly, we do have a request to go back to
Was it 12 tips?
Yes. I think the first
That
page, that one? Okay.
Yes, thank
There's
you.
some people taking pictures. No problem. I did want to ask, and you might have said this, but do you include information about Hoyer lift in the environment section, that's one big thing that's often not known.
So with our transfers, we teach stand pivot, squat pivot, sliding board transfers, but we will talk about Hoyer lifts. We do have a couple wheelchair user facilitators that do transfer via Hoyer lift. But that is something I know as a physical therapist in the hospital, we train a lot of other medical providers on how to use a Hoyer lift. So we don't particularly do it with our come roll with me activities, but yeah.
I love all the different moves and the transfers. Really important. Oh, thank you. Well, lastly, I did want to just mention the cost piece. I know that it's different in each state, but we have had the opportunity to utilize our state assistive technology program, and I know there's 56 of them. I think maybe your rehab center might, and many times they will let us borrow, let patients borrow and use for loans for more than 30 days. I don't know if that's, just wanted to throw that out because that came up a couple of times in the evaluation piece, if that would be helpful at all. It's definitely been helpful here.
Ashley, you want to speak about that?
Yeah, so we're actually thinking about doing a communication piece within our disability awareness curriculum. And Will can speak a little bit more to this because he actually implemented a little bit of the communication aspect in the UME sector. But yes, we do have some assistive technology programs within the state that will loan things out. One of our wheelchair user facilitators in particular uses a communication device to speak, and she does talk about that, especially during the panel, and some difficulty in communication she's had with some of her providers and things like that. But Will can speak a little bit about the communication piece with
Yeah,
PCP.
so in the first couple of iterations of this, we just gave students an assigned reading on like communication etiquette and communication tips for those with disabilities, speaking broadly about disability. And I think many probably read like they were supposed to, and some probably didn't. But more recently, after we established our partnership with the MedPeds residency program, we now have the MedPeds residency director come over and give a lecture every year in our course on communication etiquette. And she covers, things like first person language and just some tips for different types of disability, whether it's, hearing, whether it's, verbal communication challenges or, just general etiquette and tips for a variety of disability types. So now that's a dedicated lecture in our course.
That's great. I love it. Any other questions or comments? And thank you for going back to the publications. I think people are wanting to check in your work a little bit more. Well, I know it's not easy to find space in any curriculum for additional focus on a topic, but you've been able to do it. I know that many people discuss how best to do that, whether it's in residency, undergrad, UME or what have you. So this is a really good model, I think, for us to consider on our end, and a connection to the community. I love the PT med, there's all kinds of things that are great with this.
Yeah, so I'll speak about that a little bit. So I at the time when we did all this, I was running our MSK in skin course, and I'm an anatomist, so there's tons of anatomy we got to cover, in that course. So finding time is always a challenge. So we run this activity over 2 afternoons, and so each student has 2 hours of dedicated curricular time. We toggle this with other things that they're doing. So if they're doing like clinical skills training, they'll spend one afternoon with Come Roll With Me, like a Tuesday, and then the next day, Wednesday, they do their clinical skills training. So we try to toggle it with other activities so it's not adding to the list of things in the day, but they're doing one or the other on given days. And really, this was a pilot the first year we did it because we didn't know how well it would go and how well students would receive it. But really, the anecdotal feedback from students was overwhelmingly positive, and it's been that way ever since. Students commonly say, "This is the best thing I've done in medical school." They love that it is very, very hands-on. They love the community piece where they're interacting with actual individuals with these experiences. And students nowadays are much more attuned to health equity and those kinds of topics. And I think this also really helps them feel like they're learning something very practical that they can really use to help their future patients. So we keep on doing it despite the time that it requires because of the really positive feedback from our learners.
Well, thank you both for sharing.
Yeah,
and
thank you.
yeah, spending the time, and we hope you have a great afternoon. Everyone, thank you for joining us. And I saw the notes for the certificate of attendance. We'll get those out. But just happy holidays, everyone, and great work. Thank you for sharing it with us.
Thanks,
Take care.
everybody. Happy holidays.
Thank you.